A chest infection is an infection that affects the lungs or the large airways leading to the lungs bronchi. It can range from mild to severe and can be caused by various pathogens, including bacteria, viruses, or fungi. The most common types of chest infections are bronchitis and pneumonia. Types of chest infections: acute bronchitis. Cause: usually caused by viral infections, though bacteria can sometimes be the culprit. Symptoms: persistent cough, mucus production which can be clear, yellow, or green, wheezing, shortness of breath, chest discomfort, and fatigue. Symptoms may last for a few weeks. Treatment: often self-limiting, with treatment focus on relieving symptoms. Rest, fluids, over-the-counter pain relievers, and cough medicine may help. In cases where bacteria are involved, antibiotics may be prescribed. Pneumonia. Cause: can be caused by bacteria, most commonly Streptococcus pneumoniae, viruses such as the flu virus, or fungi. It involves the inflammation of the air sac alveoli in the lungs, which can fill with fluid or pus. Symptoms: high fever, chills, chest pain that worsens with breathing or coughing, productive cough with phlegm which may be green, yellow, or bloody, shortness of breath, fatigue, and confusion, especially in older adults. Treatment: depending on the cause, treatment may include antibiotics for bacterial pneumonia, antiviral medications for viral pneumonia, and antifungal drugs for fungal pneumonia. Hospitalization may be necessary for severe cases. Symptoms of a chest infection: cough. A persistent cough is the most common symptom, often producing mucus that may be clear, yellow, green, or bloody. Fever and chills, common in more severe infections like pneumonia. Chest pain, discomfort or pain in the chest, especially when breathing deeply or coughing. Shortness of breath, difficulty breathing or a feeling of breathlessness, particularly during physical activity. Wheezing, the whistling sound when breathing, more common in bronchitis. Fatigue, feeling unusually tired or weak. Muscle aches, general body aches or discomfort. Headache, sometimes associated with viral infections. Confusion, particularly in older adults. Confusion or mental status changes can be a sign of pneumonia. Causes: viruses, such as the flu, RSV, respiratory syncytial virus, or coronaviruses. Bacteria, commonly Streptococcus pneumoniae, Haemophilus influenza, and Mycoplasma pneumoniae. Fungi, less common, usually in people with weakened immune systems, like Pneumocystis jirovecii in HIV/AIDS patients. Diagnosis: medical history and physical examination. The doctor will ask about symptoms and listen to the lungs with a stethoscope for sounds like crackles or wheezing. Chest X-ray, to determine if there is pneumonia or other lung involvement. Sputum test, analysis of the mucus produced by coughing to identify the causative organism. Blood tests, to check for signs of infection or to identify the specific pathogen. Pulse oximetry, measures the oxygen level in the blood to determine how well the lungs are functioning. CT scan, in complex cases, a CT scan may be ordered for a more detailed view of the lungs. Treatment: rest and hydration, essential for recovery from any chest infection. Medications: antibiotics, prescribed for bacterial infections like bacterial pneumonia. Antivirals, used for specific viral infections, such as influenza. Antifungal medications, for fungal infections, usually in immunocompromised individuals. Over-the-counter medications, pain relievers, acetaminophen, ibuprofen for fever and discomfort, and decongestants or cough suppressants to ease symptoms. Oxygen therapy, in severe cases of pneumonia or if the infection leads to low blood oxygen levels. Hospitalization, required for severe infections, particularly in the elderly, very young, or those with other health conditions. Went to seek medical attention. High fever above 102 degrees F or 38.9 degrees C that doesn't subside with medication. Difficulty breathing or shortness of breath. Chest pain that is severe or persistent. Coughing up blood. Confusion, especially in older adults. Symptoms that worsen or do not improve with initial treatment. Prevention vaccination. Vaccines are available for certain types of pneumonia like pneumococcal vaccines and influenza, which can reduce the risk of chest infections. Good hygiene, regular hand washing, avoiding close contact with sick individuals, and wearing masks in high-risk environments can help prevent infections. Smoking cessation. Smoking damages the lungs and increases the risk of chest infections, so quitting is highly beneficial. Healthy lifestyle, regular exercise, a balanced diet, and adequate sleep strengthen the immune system, making infections less likely. Chest infections can vary greatly in severity, so it's important to monitor symptoms closely and seek medical advice if necessary. Early treatment can prevent complications and lead to a quicker recovery.